Welcome back to eHealth Institute. I'm Dr. Silvia and today I will talk about the Italian public health system, the access and the costs for foreign people. This is an argument which is more interesting for people who move definitely to Italy or at least come for a longer period, for example for work or for studying. In Italy, patients have the so-called tessera sanitaria, which is the Italian health insurance card. Normally, the Italians have it because they are Italian citizens. Other people have it because they are residents in Italy or because they work. I heard very often that people said that the Italian health system is for free. This is not true because people pay for these services with their taxes. And there's some co-payment for certain services like blood work, tests, treatments, specialists, the holder of the tessera sanitaria need to pay. The tessera sanitaria is issued by the tax office, which is called Agenzia delle Entrate, and it contains a number, which is the fiscal number, which is called in Italian it's codice fiscale. Having a codice fiscale doesn't mean that you automatically have the tessera sanitaria. These are two different things and sometimes there's a little bit of confusion. Holder of the tessera sanitaria of the Italian health insurance card choose a family doctor. For the children they choose a pediatrician. The family doctor is called medico di base and the pediatrician is called pediatra di base. What is important for you, for foreign people to know is that most doctors of the public health system don't speak English, so for foreign people it could be a problem if you don't speak Italian, and also that it could be a difference between a doctor's office or services you are used from your home country to a public doctor's office in Italy. Only the holders of the tessera sanitaria can go to a public doctor. This is very important, especially for people who are holders of other European health insurance cards and think that they can go to a public doctor here in Italy. This is not correct because the Italian doctors has assigned patients. They have a list of patients, the patients who choose this doctor as their doctor, and they can only see the patients on their list. Even Italians from a different region, like for example someone from Sicily, cannot go to a public doctor in Tuscany because he's not on his list. In Italy, this is something important to know. General medicine, because all these family doctors and they are general practitioners, exists only as a public service. Even if in the meantime there are also centers and private doctors who offer this kind of general medicine services in private. In particular, all the English-speaking doctors, they offer the services of course in private because the patients are not holders of the tessera sanitaria. The emergency room. Everybody has access to the emergency room, but it's free only for the holders of the tessera sanitaria. So even if you come from another country of the European Union, you need to pay something. People who come outside the European Union, they pay a little bit more, and people who come from the European Union, they have some kind of discount and pay a little bit less. But it's not for free, but you need to pay, at least for the blood work or the ultrasound or whatever X-ray, whatever needs to be done when you go to the emergency room. but the access is for everybody. You don't need an appointment, you don't need to call before, you just, if you have some emergency, you just go to the emergency room. I will dedicate a different video only about emergencies and the emergency room. And for today about the public health system, it's all from my side. So I thank you again for watching my video and see you the next time. Thank you.